Hello friends, welcome to youtube.com oblique drvet channel. I am Dr. P.R. Patel, Professor Net, Veterinary Medicine. Here we will discuss important bacterial disease, Strangles. In part 4, we will discuss necropsy finding, diagnosis, differential diagnosis of Strangles in equine species. Friends, in this presentation, we will discuss necropsy findings of the strangles. The nasal mucous membrane shows edema and congestion. There is abscess formation of the lymph nodes associated with upper respiratory tract, especially pharyngeal lymph node and submaxillary lymph node. There is presence of pus into the guttural pouch called guttural pouch empyema. This is the characteristic of the disease. The supuratory lesions are also observed in various organs of the body such as liver, spleen, lungs, pleura and peritoneum. In some of the cases there is meningitis also. Friends, now we will discuss diagnosis of strangles. In the strangles, there are characteristic signs of the strangles. We have already described that in a special presentation. The first sign is the fever, characteristic nasal discharge, abscession of the various lymph nodes, submandibular lymph node, retropharyngeal lymph node, and guttural pouch. There is guttural pouch empyema characteristic. Pain in the throat region, obstruction of oronasopharynx, and that leads to respiratory distress and a death due to asphyxiation or asphyxia. This characteristic sign that there is no any doubt about diagnosis. For more confirmation, collect the samples, exudate of the abscess or nasal sacs, and carry out cultural isolation and identification of the organism in the laboratory. Continue with the diagnosis. Gram staining of the nasal swab smear or a slide. It reveals Streptococci equi as a fluorescent purple color characteristic. The acute form of strangle shows leukocytosis with neutrophilia. Another characteristic is hyperfibrinogenemia. That is a characteristic of both acute and chronic disease. Hyperfibrinogenemia is the characteristic of both acute and chronic disease. So that is important for laboratory diagnosis. Continue with the diagnosis. Identification of retropharyngeal abscess. That is also an important part of diagnosis. And other lesions of the strangles in the upper respiratory tract can be diagnosed by physical examination by the clinician. The non-invasive technique, endoscopic examination was also helpful. Non-invasive technique, ultrasonographic examination of the upper respiratory tract also helpful. And radiographic examination, this latest tool can help in confirmation of the disease. Here we discuss sample collection, which are the sample required for the diagnosis. First, discharge. Discharge from nasal, discharge from pharynx, or discharge from the guttural pouch. That can also be submitted to the laboratory for the diagnosis. Then swab from the abscesses or pus from animal with active disease and carrier state. This will help in the diagnosis and confirmation. Here we will see differential diagnosis. Many equine viral disease that also causes nearly similar symptoms, and these diseases are equine viral arthritis, equine viral rhinopneumonitis, equine influenza, equine rhinitis virus, and equine adenovirus. So by the virus isolation and identification, this disease can be differentiated. Here we talk about differential diagnosis of strangles and glanders because both the disease produce nearly similar symptoms with difference here and there. So we have three columns. First column point, second column signs of strangle, the third column characteristic of the gland. In the pattern of disease, the strangle manifests acute pattern while glandar manifests chronic pattern. Examination of pus shows gram-positive organism of the strangles and gram-negative organism of the glandars. Lesion on the nasal mucous membrane. In the strangle, there is only inflammation, while in glandar, there is nodules, ulcers, and characteristic stellate scar of the gland. Regarding skin lesions, no skin lesions in strangles, while in glandar, ulcerative nodules on the skin. Lung lesions, not tubercle-like in the strangle, but in glandar, it is a tubercle-like. This is how you can differentiate strangles and glandars clinically. Friends, here I have discussed necropsy findings, diagnosis, sample collection, and differential diagnosis. These are the important topics for a veterinarian in the field at the same time, veterinary students. So please send this information to veterinary students veterinarian and subscribe the channel to flourish the channel. Thank you very much for observing this video.